Are you interested in migrating to the UK on a health and care visa for your carer? Well, you might be glad to know that this visa category is considered one of the most accessible routes to migrate, even without a degree. In 2022, a total of 267,067 work visas were issued, and you could be the next one. One of the most significant advantages of the health and care visa is that you can migrate without paying hefty fees to agents who charge £10,000 to £20,000. Instead, there are over 640 care homes in the UK that can sponsor your visa, and you can apply for a job as a care assistant without any agency. Hello and welcome to another new video. Today, we will be discussing the process of relocating to the United Kingdom through the health and care visa. This visa is designed for individuals seeking to work in the UK's healthcare sector, including doctors, nurses, and other healthcare professionals. So, let's get started. To learn more about the eligibility criteria, cost, required documents, and companies hiring now, watch the video till the end. You will also get the latest announcements by the UK government related to the health and care visa. So, if you are looking for a cost-effective and easy way to migrate to the UK, the health and care visa could be the answer you have been looking for. Number 1. About health and care worker visa. The Health and Care Worker Visa is a program offered by the UK government that enables overseas nationals to work in the healthcare and adult social care sector in the UK. One of the pathways within this program is the Senior Care Worker Visa, which requires sponsorship from an employer within the NHS supplier, or in adult social care. There are two categories of job codes under this visa scheme. A. 6145 for care workers and home carers. B. 6146 for senior care workers. Successful applicants are granted the right to live and work in the UK for 5 years, and upon completion of this period, they may also apply to settle in the UK under indefinite leave to remain, which opens the pathway to obtaining a British passport. Overall, the Health and Care Worker Visa is an essential program that aims to address the shortage of healthcare professionals in the UK, and provides an opportunity for skilled overseas workers to contribute to the country's healthcare and adult social care sector. Number 2. Benefits of Care Worker Visa. The UK has recognised the pressing need for experienced and skilled care workers, which is why the role of care worker has been added to the country's shortage occupation list in 2022. As a result, individuals applying for the care visa are able to meet a lower minimum salary requirement. In addition, the care visa offers a range of other advantages, including expedited entry to the UK through the Fast Track program, reduced visa fees, and exemption from the immigration health surcharge. This visa is designed to make it easier for qualified care workers to come to the UK and contribute to the important work of providing compassionate care to those who need it most. Number 3. To be eligible for a UK visa, you must meet the following requirements. 1. Age requirement. You must be 18 years of age or older. 2. Valid certificate of sponsorship, COS. You need to have a valid COS from a licensed sponsor in the UK. 3. Salary requirement. You must meet the salary requirement, which is to earn either the minimum salary threshold or the appropriate rate for the job you have been offered, whichever is higher. For instance, as of today, care workers and senior carers must earn the going rate defined by the UK Home Office. 4. Qualification requirement. You must hold a qualification at NVQ Level 3 or equivalent. This means that even students who have completed 12th grade can apply for this visa. Number 4. To apply for a visa. To apply for a visa as part of your carer requirements, there are certain additional documents and requirements that you need to consider, in addition to the 4 points discussed in Topic 3. Here are the 6 key requirements to keep in mind. 1. Financial requirements. If you're applying from overseas, you must demonstrate that you have a minimum of £1,270 in your bank account for at least 28 consecutive days, with day 28 falling within 31 days of your visa application date. However, you may be exempt from this requirement if you're applying from within the UK and have held a valid visa for at least 12 months, or if your employer is covering your expenses for the first month in the country. 2. Evidence of English proficiency. You'll need to provide proof of your English language proficiency, which can be demonstrated through exams such as ECCTIS, formerly known as NARIC, or IELTS. 3. Tuberculosis test. If you're from a country on the UK's list of designated countries, such as India, Pakistan, or Bangladesh, you'll need to provide a valid tuberculosis test result. 4. Criminal record certificate. You must provide a criminal record certificate from any country where you've lived for more than 12 months in the past 10 years. 5. Valid passport or travel document. You must hold a current and valid passport or travel document to demonstrate that you are eligible to travel. 6. Previous travel history. Any expired passports or travel documents should be presented to demonstrate your travel history. By ensuring that you have all these additional requirements in place, you can increase your chances of a successful visa application and pursue your career opportunities in the UK. Number 5. Fee of application. The Health and Care Visa offers a more cost-effective option in terms of application fees for skilled workers. Those applying for a 3-year visa will be required to pay a reduced fee of £247 per person. For those applying for a visa period longer than 3 years, the fee will be slightly higher at £479 per person. It's important to note that the application fee remains consistent regardless of whether the application is submitted from within or outside the UK. Overall, the Health and Care Visa is an affordable option for skilled workers seeking to live and work in the UK. Number 6. If you are a foreign national looking for employment in the UK, it's crucial to know which companies can sponsor your visa. As you don't have the right to work in the UK, you need a certificate of sponsorship, COS, to apply for a visa. To find companies that are licensed to sponsor your visa, you have 2 options. The first method is to search for UK Home Office License Sponsor on Google, which will direct you to the UK Home Office website. Once there, you can download the Excel file or view the full list of licensed sponsors online. Before applying for any job, ensure that the company is listed on this website. The second method is to visit the uptiersponsor.co.uk website and select Care Home from the third drop-down list under All Industries. This will provide you with a list of licensed sponsors as of the current date, which is the 14th of April. It's important to note that working with a licensed sponsor is a must when seeking employment in the UK. This will ensure that you have the necessary documentation and support to apply for a visa and work legally in the UK. Number -7 job sites to find care assistant jobs. The best job portals for finding job opportunities in the UK are 1. Reed, 2. Indeed, 3. Glassdoor and 4. Care Home. By using these 4 job sites, you can increase your chances of finding suitable care assistant jobs in the UK. It's important to keep in mind that these sites are just a starting point and you should also network, research potential employers, and tailor your application to each job you apply for to increase your chances of success. Number -8 List of companies hiring now for care assistant jobs. There are several companies in the UK that are actively hiring for care assistant jobs. While the number of job postings may vary from day to day, there are several companies that consistently have open positions. If you are looking for companies that offer visa sponsorship, some options to consider are University Hospitals, Care UK 247, Nuffield Health, Orchard Care Homes, and Dorset NHS Trust. These companies often have a range of positions available, including full-time and part-time roles. To start your job search, you can visit the job sites mentioned above or check out the careers page of each company. Make sure to tailor your application materials to each position and highlight your relevant skills and experience. Also, keep in mind that many companies use applicant tracking systems, ATS, to screen resumes, so it's important to create a CV that is ATS compliant and no longer than 2 pages. Number -9 How to apply for a healthcare worker visa. To apply for a healthcare worker visa, there are several steps you need to take. Firstly, ensure that you have all the necessary information and documentation ready before beginning the application process. Once you have everything in order, you can apply online via the official Home Office website. Upon submission of your application, the Home Office will provide assistance and request any additional information or documentation that may be required. Depending on your circumstances, you may be asked to book a biometric appointment. If you have previously provided biometric information for a prior application, it may be possible to reuse that information. However, if this is not possible, the Home Office will advise you on how to enroll for biometrics using an ID. It's important to ensure that you have provided all the required information and documentation to avoid delays or complications with your application. If you have any questions or concerns, it may be helpful to consult with a qualified immigration lawyer or advisor. Number -10 What is the new announcement regarding health and care workers? For individuals currently residing in the UK, there will be a change in the policy for health and care workers from August 27, 2023. Health and care workers will be permitted to work a maximum of 20 hours of additional paid work without needing to update their visa. This exemption will be applicable if the second role is within the same occupation code and at the same level as their primary job, or if it is on the shortage occupation list. This visa category applies to qualified doctors, nurses, health professionals, and health and care professionals working in adult social care. If you already hold a health and care visa, there is no requirement for you to apply to change your visa or notify the Home Office. This exemption will be in place for 6 months and will undergo review in August 2023. Thank you for watching today's video. If you found it informative, please give it a thumbs up. I appreciate your support, and I will see you in my next video.